Many hats of an infection preventionist in patient safety. The Infection Preventionist, or IP, is known for her versatility in wearing many hats as she works tirelessly to educate patients, visitors, and healthcare professionals about infection prevention. Not to make light of her role, here it is, illustrated with a twist of nursery rhythms. Ring around the roses, a pocket full of tissues, a tissue, we all go down. Some say this was a nursery rhyme about the bubonic plague in Great Britain that killed 15% of the population. Unfortunately, history repeated itself with the COVID-19 pandemic that ravaged the entire world and took lives of our loved ones, leaving us here to tell the tale. Old MacDonald had a farm. How do germs grow? The IP conducts training sessions for healthcare professionals on infection control protocols, proper hand hygiene, and the appropriate use of personal protective equipment. Her goal is to ensure that every team member is well versed in the best practices for preventing infections within the hospital. Twinkle, twinkle, little germs. The words, possible cauti or clabsy, keeps the IP up all night gazing at the ceiling, performing a mental RCA. The IP understands that each day the device is in spells possible cauti or clabsy, and collaboration with the healthcare team involved to get these devices out is the key. Humpty Dumpty sat on a wall. Humpty Dumpty had a huge unassisted fall. A fall with injury may result in surgery, and IP will monitor this patient even when discharged, in case the patient returns with an SSI. Rockabye germs in the hospital's bed. The IP ensures surfaces are clean and free of torn material. The IP would round with the quality team inspecting the environment to ensure cleanliness and clutter-free corridors. Jack and Jill ran up the hill to get a bucket of water. The IP works with the facility management team to monitor for waterborne pathogens. The IP collaborates with this team to develop and implement infection prevention policies that are comprehensive and effective. The itsy-bitsy spider climbed up the patient's sink. The IP rounds with quality and housekeeping, inspecting the environment, checking under the sinks to ensure nothing is stored there. Little Miss Muffet sat on a tuffet, scared of a tiny shock. The IP works with occupational health to ensure that healthcare professionals are monitored for exposure and patients are up to date with vaccinations. The IP also works with a multidisciplinary team to create highly infectious disease plans, outbreak plans, and preparedness drills to keep everyone safe and infection-free. There's a germ in my bucket, dear Liza, dear Liza. The IP provides education to housekeeping about the dangers of biofilm left in buckets and mop heads after cleaning. The IP would monitor the daily cleaning and implement evidence-based practices that further safeguards the hospital's community. Roses are red, so are gram-negatives. Violets are blue, so are gram-positives. The IP monitors the micro results to isolate or to de-isolate patients. The IP creates educational materials, such as posters and brochures, to help patients understand the significance of infection prevention measures during their hospital stay. All this being said, the IP continues to wear her many hats with pride, knowing that her multifaceted role as an infection preventionist is essential to keeping the hospital a safe and healthy environment for all.